Hi, this video is the FUE donor scar after 3 FUE surgery, and the audience want to and have a request for me to film, after 2 FUE surgery, after 3, and again, you can do multiple surgery. Not like you do one and then you can't do it. People worry about the mothball look and those stuff. It's very hard, and it depends. I mean, some people can have it. It just depends how. What tools, how big the tools is. You do a lot of tip that's really huge, and that leave more of the mothball look. But if you do what I normally do, like 0.8, 0.9 to 1.0 millimeter, you can't really see much of it. The scar is there, but it's hard to see. Again, on 2 spectrum, African American produce the worst scar versus Caucasian produce the best scar. Other ethnic is somewhere around. And even despite that he's half black and half, he's mostly black actually, but you can barely see his scar. You can see. Again, no surgery without scar. But the FUE scar is tiny dots and allows you to wear your hair shorter. Unlike the strip method, the strip will leave you a linear scar from ear to ear, where the FUE leave you tiny dots of scar. The other benefit of the FUE versus over the strip is less invasive, less bleeding, less chance of infection, less painful during recovery, faster healing. It's a better in terms of less side effect. But the downside of the FUE, number one, the cost is more expensive than the strip method. Why? Because there's more labor involved. The other is the number of grafts we can do is less. Where the strip I can do 4,000 or 5,000 grafts per day, FUE 2,500 I set. But all those, there are days I can go beyond 25. I can have done over 3,000. The max I've done around 3,800 before. Again, it's all depend on an individual. It's not depend on me. It's just how some individual hair is easy to take out. So it costs more, and the number of grafts we can do is less. In terms of the result, if you look at my result, the FUE in the strip, the result is still going to be good. It doesn't matter which method. But if you measure, it's only 5%. 5% visibly you can't tell. So you're going to have good result for the FUE or the strip when I do the surgery. Now, in terms of the FUE, we tend to recommend for mild to moderate hair loss. But that doesn't mean advanced hair loss you can't do it. You just need to know that it's going to be multiple surgery. Versus the strip method, you still need multiple surgery, but the amount is less because you can move a large number of grafts per day. Thank you.